welcome to Medical Student. Today we're going to talk about achalasia. Achalasia is a failure of lower esophageal sphincter to relax that is caused by the degeneration of inhibitory neuron within the esophageal wall. It has the two classification. Number one is primary and the other is secondary. Primary is idiopathic, secondary in the context of another disease. Now we have this esophagus and we have the stomach. Here is the lower esophageal sphincter. Usually it is relaxed so the food content can easily move into the stomach. All right, so the patient with achalasia, what will happen to that patient? This esophageal sphincter, lower esophageal sphincter, will be very constrict. All right, it will be very tight, so the food content cannot move easily into the stomach. So what will happen? There will be regurgitation, there will be retrosternal pain. All right, so there will be retrosternal pain. Let's see the chief complaint. Dysphagia will be there, difficulty to swallowing, both solid and liquid. All right, and regurgitation will be there, and retrosternal pain will be there just behind the sternum, and the patient will feel very pain. Okay, and the weight loss will be there. Why the weight loss will be there? Because the food content is still in the esophagus and it is not moving into the stomach. All right, so what we do the upper endoscopy to look for the complication, to look for the mucosal problem, to look for the malignancy. If there is no malignancy and just the lower esophageal sphincter tightness, so it is achalasia. Then we do the barium esophagram. What is the barium esophagram? Barium esophagram is actually we give the barium and then we do the X-ray. So in the X-ray we can get a clear image. Now it is a barium esophagram. Actually you can see the esophagus is very dilated, right? Proximal to the lower esophageal sphincter, it is very dilated, and the gastro esophageal junction is tight. Okay, is very narrow, so it appear like a bird beak. So bird beak appearance will be there. Now let me tell you what does it mean by bird beak appearance. Actually the bird beak appearance is like this. All right, so if you saw the bird beak appearance, so it is just like a bird beak appearance. All right, and there will be delayed barium emptying. Why there will be delayed barium emptying? Because your barium, with the barium you give to the patient, it is not moving and it is not passing into the stomach. All right, so it is still in the esophagus, so delayed barium emptying will be there. So, and the upper endoscopy, the barium esophagram, and these you will often obtain initially, and then you will do the manometry. So what is manometry? Manometry is a technique which we use for the lower esophageal sphincter pressure, okay, to detect the lower esophageal sphincter pressure. Now this manometry, after we do the X-ray, okay, so usually we do it after the X-ray for just the confirmation. First we do the X-ray, we look for the bird beak appearance, we look for the dilation of esophagus, and then we do the manometry. So in the manometry we can check the lower esophageal sphincter pressure. All right, and actually the manometry is indicated for the achalasia or for the eosinophilic esophagitis. All right, and then we do what? The upper endoscopy already we're done with that, right? And we rule out the malignancy underlying cause. Okay, so we rule out the malignancy underlying cause. So what you have to do in good surgical candidate, if you found the achalasia there, so for as a good surgical candidate, as a skilled surgeon, what you have to do, you have to do the pneumatic dilation or myotomy. Myotomy is what? Myotomy is actually you are cutting the lower esophageal muscles, right? So that allow the food to go to the stomach. All right, to pass to the stomach. And pneumatic dilatation is what? Pneumatic dilation is actually you do the endoscopic therapy for the achalasia, and you pass the air-filled cylindrical shaped balloon balloon, right? So which will disrupt what? Which will disrupt the muscle fiber of the lower esophageal sphincter. So for that your lower esophageal tightness will be somehow loose, and the achalasia patient will feel relief. Okay, so if still the patient don't feel relief, okay, and you also done with the botulinum toxin, injection. All right, so you give the botulinum toxin injection in some cases, and after that it's still the patient don't feel any relief. So what you have to do, you have to give the nifedipine. Among nifedipine, isosorbide dinitrate to release the lower esophageal sphincter. All right, to release the lower esophageal sphincter tightness and relax it. All right, now let's go to the manometry. This is the esophageal manometry actually you do. So you pass a catheter, you lubricate a catheter first, then you pass the catheter through the nasal cavity, and you look for the lower esophageal sphincter pressure. All right, now this is the numeric dilation. So what you done, you are passing the air-filled balloon catheter. Okay, so this air-filled balloon catheter, as you can see in this image, so it is disrupt the muscle fiber. All right, so it disrupt the muscle fiber and somehow relax the lower esophageal sphincter. So before this procedure, the lower esophageal sphincter was like this, very tight. After the procedure, you can see the lumen is somehow dilated. All right, and already you have done with the diagnosis, but let's see what they say. Barium esophagram is a supportive or confirmatory test. Bird beak appearance will be there already, I told you. Dilation of proximal esophagus, okay, proximal esophagus will be dilated, and the gastroesophageal junction will be narrow. Delayed barium emptying will be there. Why the delayed barium emptying will be there? Because barium is not moving into your stomach. All right, so upper endoscopy to rule out the pseudo achalasia. All right, so upper endoscopy to rule out the pseudo achalasia. Pseudo achalasia usually because of the malignancy or some other causes. So, okay, so if you found any malignancy, if you suspect the malignancy, so you take the biopsy and you do the endoscopic ultrasound. Okay, and esophageal manometry confirmatory test, I have told you already. So the esophageal manometry you usually do after the x-ray. So lack of peristalsis will be there because the food content is not moving into your stomach, so it is still in the esophagus, so lack of peristalsis will be there. Incomplete or absent esophageal sphincter, lower esophageal sphincter relaxation will be there. Increased resistant pressure will be there. All right, and chest x-ray, you can see the widened mediastinum. All right, why the widened mediastinum? Because your stomach is not getting food, and the food is still inside your esophagus, so now your esophagus is dilating, right? So for that reason, widened mediastinum will be there. All right, so this you can see, actually this is your dilated esophagus, and here is the bird beak appearance, and in this case you can see also. All right, so this is the achalasia. Now usually our esophagus do have the squamous epithelium. All right, so squamous epithelium, and the lower esophagus usually have the columnar epithelium, and then the stomach have the columnar epithelium. So once the fluid or the food regurgitate, so it will change the squamous epithelium, so there will be no longer squamous epithelium, and it will change to the columnar epithelium, and then somehow it can cause the esophageal cancer also in the late stage. All right, so these are the some finding for the laboratory technique. You can use it. All right, so let me tell you, if a patient have retrosternal pain, all right, if a patient have retrosternal pain, dysphagia, all right, and difficulty to swallow, right, and you do the barium esophagram, you do the upper endoscopy, esophageal manometry, and you found any mass there, so you have to do the myotomy, and you have to do the pneumatic dilation. All right, so thank you so much for watching this video. If you like this video, please subscribe to our channel and give the comment down below so that we can get appreciation and provide you many more videos like this. Stay safe. Thank you.